Hey guys, I am so honored to be here with Alexis McGill Johnson, and we are outside of the Supreme Court. Can you just give folks a rundown of what this case deals with and why it's so important?
Of course, Elizabeth. It's so good to be here. You know, I just walked out of the courtroom. Medina versus Planned Parenthood South Atlantic is the name of the case. And this is a case really about whether or not patients are allowed to use their Medicaid in South Carolina and choose Planned Parenthood as their provider. Governor McMaster, the current governor of South Carolina, wants to force Planned Parenthood out of the Medicaid provision statute because states have often limited who could have access to care.
Right.
And so Congress ensured that patients would be able to, have that individual right to make a choice. Instead, Governor McMaster said, my political agenda is more important than your choice, and he wants to deny the dignity of patients to make those decisions for themselves.
And so with this case, we're talking about healthcare. We are talking about basic care. We're talking about pap smears. We're talking about STI testing, birth control.
Exactly.
We're not talking about abortions because we already know because of the Hyde Amendment that federal funds cannot be used for abortions.
What South Carolina is alleging and disqualifying Planned Parenthood as a provider by saying that we're not qualified providers. There's no question before the court as to whether or not Planned Parenthood is a qualified provider. And of course we know that's true, right? 1 in 3 women has come to a Planned Parenthood in their lifetime.
I've been to Planned Parenthood.
Yes, I've been to Planned Parenthood too.
They were amazing. I remember when I turned 26 and I had a lapse in the coverage because you get booted off your parents' insurance. I was still able to go get my birth control without any interruption by going to Planned Parenthood.
Well, we are so glad that you were able to do that. And Planned Parenthood fills a gap in the public health infrastructure, right? I think that's what people need to understand about Planned Parenthood. We are a health system, first and foremost, right? And what we do is actually strengthen the public health system. Government isn't doing it all. We are cobbling together everything we can to ensure that patients have the dignity and the right to get the care that they deserve.